Good morning. In the last 7 days, more than 113,000 Iowans were tested, and the state reported more than 16,600 new cases with a statewide average positivity rate of 14.7%. And while these numbers are not where we need them to be, they are lower than they were the week prior, when nearly 28,000 new cases and a positivity rate of more than 24% was reported. Currently, younger adults aged 18 to 29 account for most of the new positive cases, 20% overall, but cases do remain fairly evenly spread amongst most age groups. Over the last few days, we've also seen a decrease in the overall number of Iowans hospitalized due to COVID-19, with the exception of yesterday with a slight increase, where a slight increase was reported. 1 week ago, on November 17th, we reached our peak of hospitalizations at 1,527, and in the 5 days that followed, we saw day-to-day decreases of as many as 76 patients in 1 day. And again, while these are positive signs, it's too early to know if they're indicators of a trend. Several national models are now forecasting the number of new cases and hospitalizations predicted in the United States and by state over the next 4 weeks. Most do predict an increase, but of varying degrees. The models make various assumptions about the levels of mitigation and other interventions which may not reflect recent changes in behavior. I want to reassure Iowans that no matter what's reported, in Iowa, we are monitoring the situation every day in real time. We're studying the data, we're talking with the leaders of our health systems and our hospitals, we're reaching out to long-term care facilities, and we're discussing additional steps that may need to be taken to keep our most vulnerable safe. And I'm asking you to have that same focus. Concentrate on what you can do now and over the next 4 weeks to stop the spread, and we know that each of us can make a difference in slowing the spread of COVID-19.